Hello everyone, today we'll be talking about aminoglycosides and tetracyclines in this video. We'll begin with aminoglycosides. So examples of aminoglycosides include gentamycin, amikacin, tobramycin, streptomycin, and oral neomycin. So mechanism of action. So they bind to the 30S subunit of the bacterial ribosome and lead to irreversible inhibition of initiation complex. So they basically inhibit bacterial protein synthesis and lead to cell death, which means that they have a bactericidal effect. That leads to mistreating of mRNA, blockage of translocation, and it has a synergistic effect when combined with beta-lactam antibiotics. Because beta-lactams inhibit cell wall synthesis, which is facilitated entry of aminoglycoside drugs into the cytoplasm. CNS penetration is poor and route of elimination is renal via glomerular filtration. Clinical uses include severe gram-negative rod infections not effective against anaerobes, cause aminoglycosides require oxygen to be absorbed by cells. Neomycin, which is not absorbed systemically, is administered orally to prepare the gut for bowel surgery. Streptomycin is used as a second-line treatment for Mycobacterium tuberculosis and Mycobacterium avium intracellular. Adverse effects of aminoglycosides include nephrotoxicity, ototoxicity, and vestibular toxicity. And risk of ototoxicity is higher when used concurrently with loop diuretics, result in tinnitus, ataxia, vertigo, neuromuscular blockade, teratogenicity. Contraindications include myasthenia gravis, botulism, pregnancy, and you need to use with caution in patients with renal dysfunction. Mechanism of resistance is inactivation via acetylation, phosphorylation, and/or adenylation by secreted bacterial transferase enzymes. So now we move on to tetracyclines. Examples include minocycline, tetracycline, doxycycline, dimethylcycline. Mechanism of action bind to 30S subunit. Amino-acyl tRNA is blocked from binding to ribosome acceptor site, leads to inhibition of bacterial protein synthesis, which has a bacteriostatic effect. Has poor CNS penetration, route of elimination is renal. Doxycycline is eliminated only via the GI route. And doxycycline is the only tetracycline that is not contraindicated in patients with renal failure. Glycyl cyclines example include tigecycline. Mechanism of action. So basically it's a tetracycline derivative and bind to the 30S subunit leads to blockage of entry of amino acid tRNA into ribosomal S site, inhibition of protein synthesis which has a bacteriostatic effect. CNS penetration is poor and route of elimination is mostly biliary. Clinical uses include gram-positive aerobes, however it's not effective against aspirids or enterococci and there's limited efficacy against MSS. Then MRSA, VRA anaerobes, partially effective against gram-negative aerobes, gram-intermediate bacteria such as Borrelia, Mycoplasma, Rickettsia, Chlamydia. Special considerations include good soft tissue penetration, which is effective for treating deep tissue infections. Glycylcycline should not be taken with milk, antacids, or iron supplements because divalent cations inhibit the absorption of glycylcyclines in the intestine. Adverse effects include GI upset such as nausea, vomiting, hepatotoxicity, deposition in bones and teeth, and photosensitivity. Contraindications include children less than 8 years of age, pregnant women, breastfeeding women, and should use with caution in patients with hepatic dysfunction. So that's all about this video. Thank you.